Hello everyone, and thank you for joining us. We'd like to welcome you to today's webinar on clinical procedures for health professionals. We appreciate you taking the time out of your busy day to join the webinar and to learn more about this text and the Navigate to resources. I'd like to introduce myself and our guest author. I'm Grace Richards, the Marketing Manager for Health Professions at Jones & Bartlett Learning. Joining me today is the author of this text, Nina Multak. In just a few moments, I'll introduce Nina, and she'll provide an overview of the content of the book. Then I'll share a quick demonstration of the Navigate to resources. The new text, Clinical Procedures for Health Professionals, just published in January. It is now available, as well as the Navigate to resources. It is a first edition. It's 196 pages. It is a two-color text with a current list price of $71.95, and the ISBN is 978-1284-032-413. Each new textbook includes inside of it an access code to the Navigate to resources, which are an e-book and online resources including videos, and you will get to see this later in the presentation. This textbook and e-book package is a great value for students so that they can have the text and e-book along with the videos all for one price. We also offer a digital-only Navigate to package with access to the e-book and online resources, including videos, for half the cost of the textbook package. And this is a nice cost-effective option for those students who may prefer an e-book instead of the printed textbook. Our author, Nina Multak, is a certified physician assistant with a master's in physician assistant studies. Nina is currently a clinical professor at Drexel University College of Nursing and Health Professions Physician Assistant Program and a doctoral student at Drexel University College of Information Science and Technology. She has held faculty appointments at the University of Florida College of Medicine, Nova Southeastern University, and the Philadelphia College of Osteopathic Medicine. She maintains professional affiliations with the American Academy of Physician Assistants, Pennsylvania Society of Physician Assistants, and the Physician Assistant Education Association, as well as the Society for Simulation in Healthcare. Nina has lectured at the local, state, and national levels, and additionally, she has published journal articles on utilization of patient simulators and standardized patients in physician assistant training programs. I'd like to thank Nina for joining us today, and I'd like to ask her to share a little bit about her background and how she came to develop this text. And then everyone would love to hear more about the content of your text, your approach to the material, and how other instructors can utilize this text and the accompanying resources in their courses. I'm very pleased to have you join me today. Welcome, Nina.
Thank you so much, Grace, and thanks, Jacob, and to those of you listening. We're really appreciative that you took the time to join us today to learn about these new resources. I'm very excited about it, and so far all the faculty and students who've had a chance to preview and initiate their use of this resource have been very happy. My background clinically, as you can see, is as a physician assistant, and throughout my faculty experience, I've always participated in interprofessional education and learning as well, and this was one of the impetuses for developing this resource. As you can see from my background, I'm very interested and experienced and involved with healthcare simulation for use to train healthcare professionals, and that interest combined with my background precipitated this resource. I contacted many colleagues who are contributing editors or contributing authors, I should say, to this resource, and everybody who I contacted was enthusiastic to participate and share their love for patient care, patient safety, and educating the next generation of healthcare professionals. One of the one of the things that was really important to me is that this resource be accessible to students as they're in their didactic or classroom training, and also that they can access it quickly when they are in the clinical environment. And anecdotally, many students before I began to work with Grace and the other Jones and Bartlett colleagues on this resource, I noticed that the students had reported that they could read textbooks with information about procedural videos. They watched YouTube videos and they watched text, but there was nothing really available where they could take their smartphone or iPad or laptop and quickly take a look at, as a reminder, how to do a procedure. One of the things that helped to decide that the videos were important is the research, which many of you who are listening may be keenly aware of, about patient safety and video use in teaching healthcare professionals to improve their skills in patient safety. And there's a lot of features which go into using the videos and how you could use them in this resource, and we can talk about that a little later. But I think that the rationale for the text was around patient safety, student access, rapid access at the point of care to information, to improve patient outcomes, and also it addresses learning styles. As you all who are listening are aware of the different learning styles of our student learners, this resource provides a visual, auditory, and as they practice, a kinesthetic opportunity to learn how to do the procedures. And also because of the way the resource is developed, students can be presented with the information from the faculty, review it on their own either through the text or online through the eBook, watch all the videos, which is really the essence and the meat and potatoes, if you would, of this resource, and get feedback through faculty members or self-guided feedback due to the way that the resources are developed and presented. And I think as we go through the content, you'll really get a chance to see more about how this is developed. So as you see from this next slide, the content is set up for multi-professional learning. So whether you teach nurses, nurse practitioners, physician assistants, other healthcare providers, or even medical students, the content of these resources will be broadly applicable to various types of student learners. The book is the e-book and the hard text is divided into different sets of procedures, basic, or what we term core procedures, and more advanced procedures. And you can use these in various approaches. You can see here the list of clinical procedures which we feature, and you can see as you go through the chapters and the numbers that the more advanced procedures are at the culmination of the resource, and you can teach them in any order or in the order that they're presented in the text and the e-book. You'll also note that there are opportunities for you to use this if you're in a clinical setting to recertify clinicians whose certification and skills have perhaps decayed a little bit because they've been out of practice, and this would be a great way to help recertify or retrain students or clinicians who are not learning on the scheduled path. Each of the procedures in each of the chapters has been developed by one or more experienced clinicians. As I mentioned previously, the clinicians have been in clinical practice and they're additionally faculty members. So we have a broad base of experience, and I think it makes it nice for the learner because each learner isn't listening to the same faculty person present the video in each chapter. In fact, each chapter is presented by a different set of specialists, and the videos are presented by a different specialist and faculty clinician in each chapter, in each set of the videos. I think that is very supportive of patient learning. So as we look to the chapters themselves, you'll note that each chapter includes an organized and efficient way for the information to be presented and absorbed. Each chapter contains vital information about the rationale for each procedure, evidence-based indications and contraindications. It highlights the learner to potential complications so that they don't necessarily find out what could possibly happen by accident. They'll know because they've read the chapter and they've been presented with the information. They'll know ahead of time. That's definitely setting our learners up for safe patient care. They'll be able to plan the procedure, so each chapter contains, and each video contains, a list of all the supplies that somebody would need to set up the procedure before they actually begin performing it, and any special considerations. There's step-by-step instructions, which are very helpful to the learner, and as well in the resource we consider post-procedure complications or considerations for the clinician or student clinician. And again, we've highlighted here for you that there are many videos that present many procedures, those procedures that have instruction on placing an item such as a chest tube or a venipuncture or a lumbar puncture or a certain type of line, also address how to remove them. So some of the procedures address insertion and removal, or each procedure that needs the item removed also addresses, as I said, both insertion and removal. So we can highlight some of the other information that's presented in the resource. And here you'll see the layout. So the goals of the procedure are highlighted at the beginning of each resource, along with the objectives of the chapter and the objectives for performing the procedure, the rationale, and any evidence-based indication and historical background also for that particular procedure. The student will be presented with contraindications and special considerations. So before they begin to do the procedure, they'll know, as I mentioned ahead of time, anything that they might need to pay close attention to. They'll be provided with a supply list and the step-by-step procedural instructions. It's suggested to the students to use these special sets of resources, which you'll see in this right blue button here on the slide. The digital video recordings are accessible through the Navigate to Advantage Access system. Each chapter has a glossary, so in the eBook version as well as the hard text, the hard copy text, the students will note that there are terms which are bolded within the text, and there's a glossary defining all of the chapter bolded items at the end of the resource, so the student can refer to these new vocabulary words that they may not be familiar with. Some of the other resources will include slide sets of your faculty instructor, and you want to present the information in a given chapter, then ask the student to read it and watch the videos. You'll be able to do that. So that's the formative component of our clinical procedures assessment. And if you want to assess the student's skills after they've had a chance to practice, you will also have access to skills checklists for each of the skills which are included in the resource, and that way you'll have an easy measure to incorporate into your course of student competency in each of the skills. And you can use those checklists before the students transition from classroom to clinical situation, or again, if you have someone who's being remediated, these checklists will also come in handy, and you can establish the baseline or the mastery level for competency based on your particular discipline and environment. There are going to be practice questions that will be available to you through the resource the resources, the resource bank, excuse me, so that you'll be able to also assess your students in written format also. And those questions will be in a format where you could either give the test, the practice test, in person in a paper-based format, or you could upload those to your learning management system and have the students do an assessment, a written assessment on their own, or in a secured test-like situation, depending on your preference, your learning preference. So we will continue to move along and take a look at some of the other contents of the resource. You will have access to sample color images of the supplies and the procedures. So as we developed this resource, no humans were harmed in making this resource. We used mannequins, with the exception, I guess, as you can see to the right, of the casting and splinting. No harm to the patient involved there. But we used resources that we had available in a lifelike format, and those of you who are involved in using task trainers for educating your healthcare students, you know that there's many studies available that show that simulation-based medical education has been proven as a great way for student learning, and that the skills do transfer to clinical practice in the environment. So we were able to practice for our students in a safe way, as they will be able to when they practice in your learning environment. In addition to the color images, the paper-based text as well as the online version have tables and charts which will help your students learn some of the information that we want to highlight. Here you have PPE requirements for common procedures. That's part of Chapter 1 on aseptic technique. And you'll see we have here, our authors have contributed to the development of this very nice table for guidance of the student as to whether the procedure is sterile or clean, and whether they need to drape or not, and also the hat and mask and face shield requirements, as well as the gown. And the students have given us feedback so far that this was really helpful for them to look at the information in focus places. In addition to the table and charts, each chapter is begun with a photo of all the supplies, and the students have also found that helpful as they begin. Here is an example of one of the chapters, and you'll see here every chapter includes evidence-based information with references at the end of each chapter. And you see at the top from Chapter 1, asepsis is bolded, so a new student who's not familiar with that term can go to the back of the text and look in the glossary for the definition. The titles in each chapter are highlighted in the same color, light blue, as you can see, and each chapter is set up the same, so this makes it organized and efficient for both the students and the faculty instructors. We can go along and look at planning for the procedure. You can see here we've used our contributing authors and colleagues for our standardized patients, and down at the bottom of the slide you can see our use of a mannequin to demonstrate how to prepare the procedure site. It went really smoothly to demonstrate these items on task trainers and the mannequins, and the appropriate details for planning for the procedure are placed before the rest of the text in terms of the step-by-step procedure. So the student gets the background and evidence-based rationale, what to do to plan so they know what supplies to get, and then it goes through the step-by-step procedures after that. So I think that the students really will find that very useful. You'll see here a slide demonstrating a table for skin preparation agents for common procedures, and we also note in the text that different institutions may have different skin prep agents available, and these are some of the common ones used among the institutions, and that's also detailed in the text, but it gives the student an idea of what type of procedure am I going to do, and what type of agent I should use, and what type of aseptic technique. Considerations are also important for them to consider. So gives them everything they need to know in a consolidated way. Here you see the next part of the chapter, which goes through the step-by-step procedure instructions. And the steps are numbered, step 1 through however many steps are in a given procedure. And images are placed along with the steps so that students can see, even if they're not watching the video, along with reading the text, or they've already read the text or already watched the video. Each section is consolidated and organized in this way. Next to the arrow, you'll see in the online version of the book that you or the student will be able to click on the icon and the video pops up in a new window, and it's really nice and easy. As a matter of fact, if a student were walking around in the hospital, they could actually click on one of those icons and gather the supplies as they were headed to the patient's room. And I think that would be a huge benefit for the patient and the student clinician. You can see we have included many steps, including how to discard your supplies in an appropriate manner. As we see this slide for the videos, we wanted to share an example with you, and in just a few minutes when Grace goes through the Navigate system, you'll be able to see an example of the video. But again, as I mentioned earlier, there are many videos to support student and clinician learning, and this is great for formative assessment, and our faculty authors, our authors who are clinician faculty members in their discipline have contributed to making the videos. So experts are the participants in the videos. And we'll review again the instructor resources. As an instructor, you'll have access to full color image bank. The color images will be available as slides in a PowerPoint format, and you'll have access to the skills checklist. So since many of you will be using this resource in both formative and summative domains, you'll be able to teach the students and assess them all from this resource. The test bank, as we mentioned, is coming soon, and you can develop your own selection of these cognitive written assessments or computer-based assessments. Here's a sample of the skills checklist, and you'll see this is again from Chapter 1, a sample of the checklist. There's a checklist for each procedure, each chapter procedure, and you have different methods of evaluating your learner: direct observation, verbal response, or written exam, or other. Each chapter has a column for whether or not, each skill I should say, whether or not each learner met competency or did not meet competency, and any comments. And there's a place for the faculty or whoever is assessing the student using this checklist to sign off, and each of you can decide the minimum cutoff point for passing or mastery learning. You may want to present some of this information in the skills checklist to your students so they know ahead of time what they're being tested on. But truthfully, as they read the chapter, those bits of information are highlighted for them. So I think that both the faculty and the students will have a clear understanding of what is on the, what would be expected of them. I'm sorry. And so, Grace, now I'll turn it back over to you to take a look at the Navigate to Advantage Access demonstration for our listeners. Thanks a lot.
Sure, thanks. Thank you so much, Nina, for that wonderful overview. I think your text includes a great wealth of fabulous figures and tables and photos along with the step-by-step instructions. And the accompanying Navigate 2 package will provide access to the variety of videos, as Nina mentioned, as well as color images and the skills checklist. As I mentioned earlier, each new textbook includes an access code with an online code to register for the Navigate 2 resources, or students can purchase the digital-only version, which will provide them access to the eBook and Navigate resources, and the ISBN for the digital access only is here, listed here, ISBN 978-1-284-023-770, and digital access is half the cost of the textbook and eBook package. And the Navigate 2 access provides access to the interactive eBook, videos, color images, and skills checklist, as we mentioned. These resources will provide students with an opportunity to review the videos and step-by-step photos over and over again for optimal learning and retention. And as Nina mentioned, the skills checklists are a great resource for students to study the steps of the procedure, and also the skills checklists are a helpful assessment tool to use during clinicals and rotations for instructors and preceptors to evaluate students as they're completing each step of the procedure. Students can access Navigate 2 via a PC, a laptop, tablet, or a smartphone. And I will show a few screenshots of the Navigate 2 platform, and then I'll go into the live resource for a demonstration. This is the home page of Navigate, and when students redeem their access code, they'll set up an online account and gain access to these resources. This is a view of our eBook platform, and you can see the video icons in the margin, and by clicking on the icon, a new window will pop up and play the accompanying video for the procedure. So this is really great. After the student reads about the procedure, they can view the video right there and see it actually performed. And students and instructors will have access to the color image review by chapter. And now I would like to share with you the Navigate 2 resources live. This is the home page, as I mentioned, of Navigate 2. And under the lessons pathway, students have access to each chapter. As an instructor, you can rearrange these chapters. I can turn the editing on here. And you can move chapter 2. Oops. Oh, I think I have it. Move chapter 2 first, or however you would like to present everything. I'm going to go back to the student view here. And under each chapter placard, students can access the eBook, chapter by chapter, the slides, the key image review, and the checklist. I can click over into the eBook, and here you can see the student can navigate through the eBook by turning the pages with these arrows. Here's one of the video icons, turning the pages with the arrows over here. And again, you can see all the charts and photos and steps listed out. Students can take quick access to the glossary here and search by glossary term if they're looking for a particular term in the book. You can see all of the resources here. So if students wanted to see all the videos in one place from all the different chapters, they could say, oh, I want to take a look at the local anesthesia video, and they could click on it right there. There's a glossary. Students can add bookmarks to certain pages. They can add notes. If they bring a note over here and say, oh, okay, study for quiz, save the note. They can add a video note, audio note to themselves if they'd like. As an instructor, you can add in notes voice notes to your students so that it'll publish to all of their eBooks so they can see a message that you might like to share with them within a certain procedure. If you have an added step or you'd like to provide them with a link for additional information or a link to a different video that we haven't provided, you can add links. You can choose to preview the book with 2 pages or 1 page. You can zoom in and out to make it larger print. Students can use our different icons for drawing and highlighting. So if you want to, oops, I'm back on the note thing there, sorry. Let's do a draw. If you want to circle something that you'd like to take a look at, you can highlight something that you might like to look at later with 5 different highlighting colors. And sometimes using this within the webinar system is a little wonky, so it might, I don't know if everything's highlighting as I'm doing it, but I made a little drawing. You can use an arrow or highlight. If you want to erase something that you've done, they can erase it over there. And I will pop up one of these videos so you can take a look at that. And it pops up in a new window, and hopefully this will pop up for you as well.
Make sure that you're starting off with a clean, dry surface. The next thing you want to do is set the package.
I'm not sure if you can hear my laptop audio and see the video, but that's an example. And let's see, out of the, I think we went through everything on the eBook. We can also go in the Learning Tools pathway, and if students would like to access all the eBook chapters in one spot, they can do that instead of via the placard. If they would like to access all of the key image reviews, they can do that in one spot. So there's all the images. If the student would like to see all the images in slides, we can do that, and I'll launch that. Hopefully this pops up here. And it should be loading a PowerPoint slide with the images shortly. So as an instructor, if you'd like to add notations to these images within the PowerPoint, you can do that. And all of the skills checklists are available in one spot. So you can open up and have access to the PDF and print this PDF file out. That was just a quick look. We can provide individual demonstrations for anyone who'd like to see that in more depth by contacting your account manager. I think this text and its Navigate to resources provide really helpful tools for students and instructors, and we hope that you and your students will enjoy using this text and the Navigate resources in your course. I want to thank Nina and all the co-authors for all their hard work on this wonderful text. I think it's a great addition to our list of healthcare resources, and we're really excited to release it and hear instructor feedback. So thank you, everyone, for joining us today. And I'll leave you with a screen showing how to contact your account manager. You can do that online and send an email at go.jblearning.com/findarep, or you can feel free to call us at 800-832-0034. On our website, you can learn more about this text at go.jblearning.com/Multak. That's Nina's last name. And online, you can request a review copy or the Instructor Resources, or feel free to get in touch with your account manager to set up your instructor course code. We'd be happy to do that. And for anyone that has asked a question, I'll be sure to have your account manager get in touch with you, whether it's about training on how to add in notes or about setting up your course code. So thank you very much, everyone. I'd like to thank our operator, Nina, also for a great webinar today. And please give us a call and let us know how you like this. We hope that you will try it and share it with your students. Thanks, everyone.